COVID-19 can be characterized as a pandemic.
That was 2 years ago today. The World Health Organization declaring COVID-19 a pandemic. Precautions to fight the virus were put into place, but despite that, cases, hospitalizations, and eventually deaths would soar to mind-boggling numbers. The outbreak killing more than 6 million people worldwide and infecting another 454 million. And those are just the cases that we know of.
According to Johns Hopkins University of Medicine, over 966,000 Americans have died due to COVID, and 2 years in, the rippling impacts are being felt. No one is immune from the effects of COVID-19. This timeline showing a few of the biggest events during the pandemic, from the first reported case in the United States being from right here in Western Washington, and now to tomorrow when the statewide mask mandate will officially lift.
Fox 13's Matt Markovich joins us in the studio with some concerns being raised now by local health officials.
Yeah, and it concerns this map. This is the current map of the COVID-19 risk zones in Washington state. This is a county map. And as you can see that the orange is actually the worst, where they're actually suggesting, the CDC is suggesting to wear a mask. And that's all the way down in Asselton County, down in the down corner down there. But you'll see that most of the state is green, which is low risk. You can wear a mask. But is this map really oversimplified?
It's masks off if you want to.
I think it's great that it's optional. However, just out of courtesy to others, I'll probably still wear it unless I'm outside and not in close contact with other people.
I haven't really been good about wearing mine the last probably few months or so, just because it just seemed to kind of die down a little bit.
King County's chief public health officer believes it's okay to go maskless outdoors, but suggests that people with underlying health issues continue to wear a mask indoors.
COVID-19 is still circulating and some risk remains.
I believe in the CDC, and I feel like if they say, hey, you need to do this, I'm all in.
Dr. Duchin believes the new easy-to-understand green, yellow, and orange risk assessment thresholds set by the CDC may be too lenient.
So I am a little concerned about that threshold being too high.
Especially when it comes to rates of hospitalizations of COVID patients.
I am a little bit concerned about what seems to be a high hospitalization threshold for triggering implementation of community measures like masking.
Currently, the CDC's assessment map shows most of the state, including King County, in green, the lowest risk, but Pierce County is in yellow.
We don't believe that that data is still correct on the CDC community levels site.
And it's that hospitalization threshold that Dr. Duchin believes is too lenient, which is actually putting Pierce County in the yellow, according to the CDC, but trending downward, say local health officials.
We're pretty optimistic that that trend's going to continue and that very soon we'll be at a low CDC risk level.
It sounds like it's not up to date, at least in terms of Pierce County.
It isn't, but they're working on resolving that.
So the numbers in any county start to trend back upwards, the mask could come back.
If you think it is problematic, get vaccinated and boosted, because frankly, this mask really isn't stopping the virus anyways.
Now, I asked Dr. Duchin today if King County will be scaling back the availability of vaccination and testing sites. He said the county will be, quote, pivoting soon, but did not say what or when that pivot would take place. Back to you guys.